One, two, and three. Good afternoon. This is Edith Bradley for Nursing 441, Western Carolina University. This project is for diabetes management in geriatric patients, and I have the honor to interview this wonderful doctor I know for many years. Dr. Russell has 36 years of experience in medicine. He graduated from the University of Kentucky in 1986. And also, he's a family medicine board certified. He provides diabetes management, weight loss, minor procedures, mental health support, and many, many things in his practice. Also, he enjoyed caring for patients in a skilled long-term care. And in one time, he had a many nursing homes in Hendersonville. And one of his passions of Dr. Russell also is babysitting, right, Dr. Russell?
I love to babysit.
You have a grandson?
I have a grandson who's 2.5.
And you like to travel,
Enjoy
reading,
travel, and I like to read,
and walking?
generally, exercise with my dogs, but also lift weights. Try to stay healthy.
And I'm going to highlight this. Dr. Russell in 2020 was part of this big team in Hendersonville called the Strike Team that were supporting the skilled nursing homes and giving help to them. That was very honorable and amazing from his part. Dr. Russell, we're going to start with this question about diabetes. From your experience, what are the most common diabetes management challenge you see among your older patients?
I think the most common thing I see is probably non-compliance. But I think that non-compliance would relate back to diet, to exercise, and also the medications. And when I look at that, probably the biggest root for that is education. The patient really understanding the importance of uh, the need for a healthy diet and what diet they're supposed to eat for exercise. And even on the medications, I think it's a big benefit if patients understand why we're giving them these pills or potentially shots, how those medications work. I think if they have a better understanding of all the stuff that I just mentioned, they're more apt to be able to follow the instructions that we give.
Dr. Russell, in this period, we were gathering information and working and shadow you with some of your patients. We noticed something about uh, some patients. They know how to read labels. We all know how what is in the can of soup and the sodium, but we found something in particular. Patients starting with diabetes, they don't know much about carbohydrates, proteins, and sugar added sweeteners. Do you think that would be one of the priorities for the patients to start teaching when they're pre-diabetic, borderline diabetes, or for everybody in the community?
I agree. I think it would be. I think a better understanding of what you're taking in. And I think we all hear these words of protein and carbohydrate, but also, is it a simple carbohydrate or a complex carbohydrate? So I think better education for the patients as to what to look for, or even potentially a cheat sheet or potentially an app that would allow them to be able to make the better choices when they go to buy foods.
What about when you got a new patient and you notice that have difficulty understanding nutritional fact labels when they're making food choices? What would be the first advice you would give it to this patient?
Well, I think um, what I always encourage the patients to do is to uh, be able to have a meeting with a nutritionist or a dietitian, simply because sometimes the nutritionist and the dietitian can help cut through the confusion. And I've also mentioned with you in the past about what I call a diet diary. I find that human beings are creatures of habit. We get to where we're raised on a particular diet. I like to ask my patients to keep a diet diary for a couple of weeks before they see the nutritionist. In my past experience, I've had patients think, "Oh, this one particular food is really healthy and good for me," and the dietitian is able to point out to them that it's not, and they may be actually ignoring stuff that are. So I think it's very important to know what the patient is eating, and for the nutritionist to be able to see what are common foods.
Exactly. I want to bring up this experience I had, a personal experience traveling to Peru, and I mentioned to other doctor about those octagon labels they put in the food in Peru, and it was a bill in 2013, and after many years they passed the bill. It was so hard, but very helpful for people out there that don't know that there really has much sugar or any sad fat or anything that is not good for your health. Well, here in America, in congressmen, they're trying to pass a bill also to label those sugar things and all those carbohydrates and put an alert in the food, in other words. And my question would be, do you think teaching how to read food labels could improve their abilities to manage diabetes to the patients? Why or why not? Why not?
Well, I think the answer would be yes. I think, again, the better understanding you have of like say protein, carbohydrate, then it allows you to make better choices on the foods that you buy. And of course, suddenly there's a lot of patients that will be caught within a particular budget, so they may be trying to go toward the cheaper foods. So I think having a better understanding of food choices could lead then to a healthier diet, and therefore give them a better chance of good control of their diabetes.
Exactly, Dr. Russell. If we put a community of for everybody program for diabetes, understanding what it can be the risk to don't manage diabetes since the beginning, like a checking A1Cs, noting the overweight, how would you measure whether a diabetes education program would be successful?
I think the I think if we're looking at a community-based educational program, I think the success of that we don't need to focus necessarily on pounds or A1Cs because there's so many factors outside of what that program could control. I think I would base it more upon education, the availability of education to the patients, the convenience. Are we making sure that it is like fifth or sixth grade reading level in case the patients may not be able to understand? Um, Ultimately, obviously, the patients are the one that make the choices. Uh, but yes,
Exactly.
we could see a trend potentially with weights, a trend with A1Cs coming down, hopefully a trend of people who are pre-diabetic not becoming diabetic. But I think the importance of the community education is to educate the people in an appropriate manner. So we've given them the best chance to be successful.
Exactly. And also we should give a choice, like we can say, hey, today, Monday we eat this, Tuesday, but it's also a barrier in culture, like certain cultures, Latin America, Asian, they eat different type of diets. According to the CDC, I think the last census for diabetes in United States, it was 40.1 billion people with diabetes, and the highest levels of ethnicity was the 17.4 for American Indians and Alaska Native people. And believe it or not, the Caucasian people were the lowest, with the Latinos in the middle. And that said, then their diet, like you said, Dr. Russell, is different. We can
Mhm.
offer different type of nutritional, different type of intakes and protein, carb, but we can change culture. And one last question. What message would you give to all those patients with diabetes out there that are watching this video? What recommendation would you give it to them in the beginning when they just got diagnosed borderline diabetes, so they're noticing something is changing?
Well, I'm going to sort of go down what I would normally talk about with the patient that I would have. I think obviously is the importance of diet. I mean, if we are able to hopefully be able to try to put in healthy foods and be able to consume those foods and being careful with it. I mean, our natural tendency is frequently to overeat. and potentially overeat carbs because sugar and sweet things are really good.